The article that I used addressed clinical depression and called for designing interventions that are focused more on preventative interventions. In order to make these interventions sustainable and accessible to many, there needs to be a collaboration of mental health professionals and public health professionals to enact a multi-level approach to the prevention of depression. According to the paper, 17% of adults and 12% of adolescents say that they have experienced some sort of depression before. The effects of depression can be severe, as it has been known to elevate mortality, exacerbate existing cardiovascular disease, and a study showed that depressed individuals are 11 times more likely to commit suicide than those who are not depressed. It's so important that people get treated, but some never do. Adequate mental health treatment for depression is also scarce for individuals. Depression is common, frequently chronic, and associated with substantial costs for individuals as well as for society. The article emphasizes that the efficacy for the interventions provided needs to be improved greatly. They mention an agenda that states goals which are to develop, evaluate, and implement interventions that will lead to reductions in the incidence of depression. There is a combination of contributions of clinical psychology and psychiatry for the development of preventative interventions with a public health approach. The implementation of interventions to prevent depression requires skills and the theoretical perspectives of mental health professionals and public health professionals. A common barrier that exists is the fact that mental health disciplines are concerned with the treatment of individuals, while public health is concerned with the prevention of diseases in populations. So, they have different overarching goals, but they need to be bridged in order to effectively implement these interventions. The article mentions some recommendations to facilitate the collaboration between the disciplines. One was that mental health professionals must play a primary role in achieving the efficacy of universal preventative interventions, and the other was that the two groups begin to share responsibility for the goal of expanding the reach and sustainability of the interventions. Placing more responsibility on the professionals gives them a greater sense of accountability. It's not just the professionals that the article mentions, though. Using these people requires money that not all groups have, so it's suggested that instead of relying on so many professionals, existing providers, like teachers or school counselors, play a huge role in implementing these interventions as well. The blog that I found for this topic introduced an app in the works called Panoply, which is meant to help people who suffer from clinical depression. Creator Robert Morris explains the app, saying that it reframes thoughts and experiences for people. If, for example, someone has a bad experience and they begin to twist it up in a way that could be overgeneralizing and paranoid, someone else in the app can provide feedback that gets them back on a realistic mindset. People are meant to help others, and he believes that there is a greater benefit from giving advice than from getting it. For the app, there's software designers and professionals who look at the app and see whether it's a plausible idea. There's also a set of eyes, proctors, in a sense, who look at everything before it actually goes up to prevent any kind of bullying or harassing of any sort. Morris also explains a technology that isn't used for his app specifically, but that's pretty cool. The tech restricts certain people from using the app if they are bullying or trolling people, but in a passive-aggressive way. The app might not load or just crash all the time, but it shows who is not welcome on the app. Morris explained the help that he received from programming groups, health professionals, like a clinical psychologist at Northwestern, focus groups who provide feedback, and the interns who screen the posts and make sure people are helped.